it's Maddie. Welcome back to my channel, and this is more of a impromptu type video where I really wanted to share this because obviously you can tell I have this really nasty looking lesion on my neck. I did let a lot of you know that, like, hey, I was in the ER in urgent care basically within like a 12-hour period of time, and I want to let you guys know I was okay. But I really wanted to make this video because this infection can be very deadly if you don't take care of it, number one. But number two, just to make awareness of like when to go in and get help, because it can happen to anybody. It doesn't matter if you have diabetes or not. It doesn't matter who you are, what you do. This type of infection can happen to anybody. But before I delve into this infection and kind of my story as to what in the heck happened with this whole neck thing, I wanted to let you all know I got my dental hygiene license last Friday. So today is July 7th. I got it on July 2nd after pressing the state of Wisconsin and having them put together the last 3 pieces of information. So over half of my classmates are now licensed. Some of them are now working as hygienists because their office is open. However, my office is closed this whole entire week for the 4th, which is super nice. They give us some pretty nice holiday breaks. So I see my first patient starting next Monday, so I'm super excited. So that's one good thing out of the way. And thank you all for your support and all the congratulations. It feels great to finally be part of the working world. I was able to work as a dental assistant for 2 weeks prior to me being licensed. Now, I wasn't doing the four-handed dentistry like a dental assistant does, like passing instruments, but I was basically doing everything else, like taking x-rays and doing sterilization and learning all their different tools and how to bag them. And I guess helping, I kind of helped out one of them because one of them was gone for a while. Like, we have 2 dental assistants and one was like on vacation. So I basically, all I did all day for her was break down rooms and take all her instruments and bag them and clean them. So I kind of got to know what some of the instruments are used for different things like crowns and root canals and fillings and extractions and all those fun things. So anyways, that's exciting. That's done. But anyways, let's jump right into this story as to what in the heck happened. I'm going to try to keep this video like under 15 minutes. But this is more of an awareness video for anybody, but I just kind of want to say kind of my story of it and what happened. So if you're watching this video, I didn't really tell you guys what kind of infection I had because I wanted to make this video as not necessarily a surprise video, but I wanted to draw people's attention to this because some people would be like, oh, what's this? So as you can see on my neck, I have very much an infection that is pretty much almost gone now. I've been on antibiotics for my 3rd day of antibiotics now out of 10, so I have a week left. I have what we call cellulitis. Basically, cellulitis is a major skin infection. And it can happen from a variety of different things, and it's one of those things that if you don't take care of, it can actually go from being localized, like mine was, to being in your bloodstream, and it can absolutely cause a heck of a lot of damage to your brain through fevers. Obviously fevers can cause nerve damage, organ damage, and it can kill you when it's in your bloodstream. Like, if you think about it, if you have an infection in your bloodstream, it's kind of like DKA. When you have that much acid in your bloodstream, your blood almost is like poison to you running through your veins, and when that goes through all your different organs, that's not healthy, right? Like, that's just a way to kill yourself, basically. So luckily for me, mine wasn't to that point, but I had initially thought it was when I went in the ER 12 hours later. So I'll give you a brief background of kind of what cellulitis is, the symptoms to look for, and then I'm going to tell you my story in my own words, what kind of happened and how kind of led me and prompted me to get more information and further clarification on getting treatment for this, because I didn't obviously want to let this go any longer because symptoms were not getting any better. As an FYI, none of the information I am here seeking out here for you is medical advice. Always consult a physician, doctor, or your own practitioner for your own health and well-being. This is coming from my perspective, what I was told. I'll tell you kind of some of the things the ER doctor told me, as well as some of this general information I'm finding from Mayo Clinic. I always source Mayo Clinic because it's obviously a big, well-known resource for people, especially in the United States. I think internationally you probably could know what Mayo Clinic is. Well, they're a pretty major organization that fights a lot of different diseases, but they have a basic review of cellulitis. And I know a lot of people, when I talk to them, like close friends and stuff that know about this, they are like, I never heard of cellulitis. I've heard of it, but I never thought I'd be able to get it. Like, it's more common the older you are and stuff, and there's some other risk factors that can play into getting it, but nobody is immune from getting cellulitis, and it can happen to anybody. So this is what cellulitis is, some of the symptoms, and then we will get into my story as to what kind of triggered my cellulitis. So cellulitis is a very common, which is interesting because I don't hear a lot of people getting it, but apparently it's more common than you think. Potentially serious. It actually is serious. I mean, if you don't take care of it, you're going to have problems. Bacterial skin infection. The affected skin will appear swollen, red, and typically painful and warm to the touch. And I'll tell you what my pain felt like later, but it was not exactly fun. Typically, cellulitis affects skin on the lower legs, but can occur in the face, arms, and other areas, aka Maddie's neck. It occurs when a crack or break in your skin allows bacteria to enter. So if you think about it, a cut, an abrasion, a burn, an open wound, anything like that, boom, you have a very high risk of getting cellulitis if you're not careful. So symptoms related to cellulitis usually occur on one side of the body. However, I had swollen lymph nodes on both sides, but obviously most of my symptoms were on one side. So you have redness of the skin that will expand and swell. And I'm actually going to show you guys some pictures, and I'm going to insert them here as I go. If you don't like that kind of stuff, please don't look at them. But I mean, I want to make awareness of what it can look like. Swelling, tenderness, pain, temperature increase, high fever, red spots, blistering, skin dimpling, and then I had these kind of weird looking pimple looking things. You need to see a doctor to treat cellulitis early, because if it spreads, you can get what you call, a septic infection. You basically have it in your bloodstream. You have to seek emergency care if anything changes and you have a high fever. Cellulitis is caused by bacteria, most common strep and staph bacteria. They naturally live on your skin, enter through a crack or a break. The most worrisome case is of a more serious staph infection, which you probably know as MRSA, which is methicillin-resistant Staphylococcus aureus. It's just the same. It's a staph bacteria that is resistant to the antibiotic methicillin. It can occur anywhere on the body, but it's more common, like I said, in lower areas. You're more at risk if you have open wounds from surgeries, cuts, punctures, burns, ulcers. Those types of things make you at a very high risk of getting this nasty skin infection. Also, animal bites can cause cellulitis. Bacteria can also enter through areas of skin that's flaking off or kind of starting to peel open. Any little port that's the bacteria can get in. Risk factors: if you have other skin conditions, you have a higher risk. If you have lymphedema, chronic swelling, high risk. If you've had a previous history, now I'm kind of had a previous history, so I have to be a little more cautious about what can happen. You're a little more prone to developing it again. Obesity, only because if you have so much body mass and you have so many layers of abdominal and or body fat, you don't necessarily know if there's a break in your skin because you have so much of it, and it could be hiding, and then that leaves a very easy moist place for bacteria to get trapped into a wound that you may not be aware of, and it may not heal well. And if you think about it, if you're a little more obese, if you're obese and you're not healthily eating and all those different things, you're putting increased risk on your heart and all your other organs, so your skin isn't going to heal very well. Weakened immune system. Now, I don't like how they put diabetes in this immune system. Somebody had made a comment saying, diabetics, you're so, the way you worded it was, I'm going to reword what they said. They basically said diabetes, you're at such an increased risk of having major infections that you can't recover from and you heal slow. The answer to that question in that statement is yes. However, if you control your blood sugars as close to a non-diabetic as possible, you're no different. Now, as a diabetic, I have a higher risk of periodontal disease, meaning losing bone around my teeth and losing my teeth later on in my life. But I have the same risks as a person without diabetes to get periodontal disease if I control my blood sugars. It's all about blood sugar control. Control your blood sugars, you will have wound healing. Control your blood sugars. Your risk of infection is the same as anybody else with diabetes. I had blisters on the bottom of my feet 3 weeks ago from walking so much, and they healed within 5 days. Because I kept my blood sugars normal and I watched them and I took care of them. I eat healthy. Like there's so many factors that play into healing that it doesn't make a difference. And I already know this video is going over 15 minutes, so I'm sorry. I'm going to try to keep it under 30 because I feel like if my videos go longer than 30 minutes, I'm going to break them into 2 different parts, especially if I'm talking more on big topics related to diabetes or my life, because it's really hard to keep everything in a single pinpoint topic. So anyways, you are not as an increased risk of having it. I think when they lump diabetes together, I think they're talking about like type 2. I mean, not saying type 2s are uncontrolled, but they're more likely to go along with obesity and all the other things, right? If you have cancer or HIV/AIDS, you're more susceptible to infection. The ER doc did tell me, like, yeah, as a diabetic, you got to be cautious of infection because you have this piggy on your back that you got to watch. But when they tested my blood sugars and stuff, like, they were slightly elevated just because of antibiotics, and he expected that. But they were like 170. It wasn't like my blood sugars were 380. And he said keeping your blood sugars, you know, between your, he said if you say you keep your blood sugars between 70 and 160, like 75 to 80% of the time, he said, your healing chances are basically the same as a non-diabetic. Like you're going to heal quick. So I don't like how they word that. It really depends on your glycemic control. Does that mean that my blood sugars are perfect all the time? No. As a matter of fact, right now, I'm a little resistant to my antibiotic. I'm actually 217, but I'm dropping. I'm giving myself a little grace with the antibiotics. I only had a couple spikes, and I'll talk a little bit about antibiotics and my experience right now. Dealing with my only experience having antibiotics in my body with diabetes. It's a little bit more of a challenge to handle, but it's not as bad as you think. So basically he said there's nothing you need to worry about, and I don't like how they lump weakened immune system with diabetes. Also, I'm young. I'm going to have a pretty healthy immune system if I keep myself healthy, right? If it complicates, obviously it can go into your bloodstream, but I also just learned reading this article, I'm kind of not reading you the whole thing because we'd sit here forever, reading this article that they can also turn into necrotizing fasciitis, which is gross. Basically, it's necrotizing, meaning it's killing off healthy tissue, basically. It's basically bacteria that'll eat away at your healthy tissue and it can kill you. To prevent cellulitis, I mean, it's anything common sense. Wash your wounds, clean your wounds, antibiotic salve, I should say. Dressing the wound appropriately, meaning covering it up with a bandage or a wrap or something, and then watching for signs of infection. And then it also just says people with diabetes and poor circulation need to take extra precaution to prevent skin injury, especially in your extremities. This is where cellulitis can really go, is in your extremities, and then the second most common place is face region, which is where I have. But you can have cellulitis anywhere in your body. I know somebody that recovered from cellulitis that was actually as a close friend of mine, but she has some other health issues and it made it very hard for her to do. And I think hers actually went somewhat septic because she was in the hospital for 12 days and hers was completely on her right side, I think. But it was in her arm, like the middle part of her arm, but then like it went down her whole entire body. But obviously common sense, watching your feet, moisturizing your feet. I hope to be making a diabetes foot care video. As weird as it sounds, like I found a lotion that works for my feet, and when people look at my feet, they're like, are you diabetic? Because your feet are like beautiful. And I'm like, okay. Anyways, you gotta watch any part of your body as a diabetic. Be very wary of your body, and especially your feet as diabetic, because that's a very common place. If a diabetic would get cellulitis and you're not careful, that's where it can end up getting, because if you have wounds on your feet that won't heal, you're pretty much guaranteed that your glycemic control is pretty minimal. You're not doing a good job controlling your blood sugars, unless you have other autoimmune diseases on top of that might make healing hard, like lupus or something, or RA, or any other inflammatory disease that can make your healing harder. So you got to watch that kind of stuff, but you got to watch that kind of stuff no matter who you are. This doesn't just apply to a diabetic. This applies to anybody. So anyways, that's what cellulitis basically is, and I'll get into my story. So, I started working a couple weeks ago as a dental assistant, right? So I don't know what happened, but the most midline portion of my neck, I'm pointing to it. I'm not touching this wound. I won't. But right here, I had a newly formed skin tag. And it was about, the size of a little bit smaller than that freckle in the middle of my palm. So very, very tiny. And it was kind of a red purple color. You get some red purple color moles, no problem, right? I haven't had a skin tag in years. I have one here on the back of my neck that has not done anything, bothered me, got infected, nothing in years. I leave them. If my doctor don't want to remove them, because I get a full body inspection every year at my physical, I don't mess with it, right? I don't know how this skin tag happened. It's such a weird spot. I thought maybe my lab jackets hit it or something weird. But the only thing I can think of is I wear a lanyard for my keys, and I don't know if I just happened to hit my neck right and my neck was turned a certain way, because it's kind of on a muscle line. This is your sternocleidomastoid, this gigantic muscle that runs from the back of the skull here all the way down to your collarbone. So it's kind of right on my SCM, and I'm thinking, oh, maybe I hit it funny with my lanyard and it just happened to have my neck turned a certain way, and I rubbed a little friction and started a skin tag. Didn't think nothing about it. Like a day and a half, the very, very tiny skin tag falls off. Now, mind you, I took a shower. I didn't see any big open massive infections. Everything looked fine. It wasn't like an obvious nick or cut. But all it takes is for that little bit of time, maybe I didn't quite clean it fast enough, or I just wasn't paying attention fast enough for enough bacteria to get in there and get underneath it. That is what I believe, and got my skin infected underneath. A couple days after the skin tag fell off, I started noticing signs of an infection. So I started having this almost blistery, pussy looking infection, and it turned kind of purpley. It was draining. It was yellowy. Then it was kind of white, then clear pus. It was just nasty. I'll show pictures as everything progressed here. And I had swollen lymph nodes by day 3 of the infection, and then I had like chills a little bit, but nothing bad. I'm like, well, I'm always cold. And then I had my temperature orally was 98 to 99, and I'm like, a little high for me, but it's not really super high. And I'm like, well, I am working. I could be a little bit more warm than normal. Like, who knows? Anyways, I got through all that, started to feel fine. As soon as Friday, Saturday, and Sunday, this thing scabbed over. Saturday, I felt fine. I actually did poppy promotion and everything. It was really warm. But then, like, I would say Saturday night into Sunday, like, I noticed the scab was turning yellowy green, and there was pus coming out of it, and then the redness just went around the scab, and I'm like, oh, it's getting infected underneath the scab. Great. That's when I knew there's something wasn't right. Now, my progression of healing was nice. If you think about it, within like a good week, I had the scab, you know, everything. There was really nothing else. So the way that the wound was healing was absolutely appropriate as far as the healing progression, and that's what the ER doctor told me. However, when you have that much pus and stuff underneath, and there's so much redness and swelling and heat and inflammation, it's not good. And then I got these little pimples kind of around the outside edge, like maybe 3 or 4 of them. And I'm like, okay, this infection is definitely getting worse. I'm not really, feeling the greatest. Let's do it. I cried myself to sleep Sunday night, woke up Monday morning, and I went to urgent care. They took one look at me, and they said, oh, yeah, that's definitely an infection, and I'm going to get you some lab work. So they gave me some lab work, and they did all the other stuff, and they said, yeah, you're going to need antibiotics. I'm a little irritated that the urgent care doc that I did see, they put it on my chart that it was cellulitis, but never told me. The only thing she remember her telling me about was, like, I'm more worried about, like, it being you have MRSA on your skin and it got underneath, which is the methicillin-resistant Staph aureus. So she goes, the medication I'm going to give you is called doxycycline. I said, I'm very familiar with it. We give it to patients with perio disease. And I said, my dog took it for Lyme's disease last year. So I was very familiar with this medication. I know you can't take it while you're pregnant. It actually can cause some intrinsic teeth staining in a baby while developing in mom's womb and whatever. So whatever. So she talked about that and whatever. And while I was waiting for my blood work, they gave me a shot. And I remember the name of the shot now that they gave in my butt. In the urgent care, it was ROCEPHIN. Different antibiotic. They wanted to give me an injection to kind of quick start getting antibiotics running through me. I don't know if the antibiotic did much or if I had really kind of an infection that was stubborn, but the only thing it really did is it took away like redness for maybe like 2 hours, and that's all I remember. First time I ever got a butt injection, it was kind of actually interesting because the nurse said, you know, most people sit and scream at getting injections, especially in their butt, and they hate it. And I'm like, you know what's more uncomfortable for me is bending over like this on the table than it is actually getting a shot in my butt. And she thought that was hilarious. Anyways, by the time that happened, I picked up my prescription. My white blood cell count was higher, but it was still within a normal limit. It wasn't like 20,000. It was like 7,000 or 8,000, so it was fine. Maybe 6,000. So she said it's not like super high. If it was, I'd have you sent right to the ER and have you pumped full of IV antibiotics because of this infection. Again, at this point, I looked at my sheet and it said cellulitis possibility, and then gave doxycycline for possibility to cover for MRSA. The reason why they gave me doxycycline is a good antibiotic to treat for MRSA. Anyway, so that whatever. I went home. About 3 o'clock comes around, I'm feeling like shit. Like complete shit. Like I'm starting to get my heart, whatever. Oh, it's another thing I'll talk about. I was extremely tachycardic at the urgent care. I was like at 140, and she was asking me if I had signs of a heart attack. I'm like, no, other than the fact my heart's beating really fast, I feel fine. And I had to wait till 7 or 8 o'clock to take my doxycycline because she wanted enough time between the ROCEPHIN and the doxycycline. So I'm like, fine. So from 3 to 4, 5, 7, I was like super miserable. I'm like, oh my God, like I'm dying. Like I'm fevered, I'm crying. I can barely lift my head and neck up because I'm in so much pain. I have so much pressure in my head. It felt like somebody was sticking a hot poker in my neck, which it was excruciating, but what was even more excruciating and painful was the stiffness in my neck. I actually came to the point before I went to the ER, I couldn't even open my jaw because of how tense the swelling in the lymph nodes of my muscles were from all the infection. And again, I'm going to show you some pretty gruesome pictures. This is what I looked like. This was nasty. I know. I felt like garbage. And this was July 5th, mind you, okay? July 5th. So. Anyways, I took my medication at 7 o'clock and was just monitoring things. I took my temperature at 7 and 8. I was up 2.5, and I was, don't ever Google, but like I wanted to know at what point do I need to go to the ER here because my temperature is pretty high. And it said anything above 103 as an adult, you go right to the ER because you could boil your brain. And the thing on my head told me like I was 107. I'm like, okay, that can't be right. So I took, everything I was doing was orally, which was good. And actually the temperature I took at home before I left for the ER was the exact same temperature. So I knew that my thermometer underneath my tongue was accurate. So that was fine. I took my antibiotic, and then I kept cooling myself down with ice packs, sucking on ice, drinking a little bit, as much water as I could or whatever. Ate a little bit of scrambled eggs, and it was fine. So I got my temperature down to 100.5, so I dropped myself a degree. I'm like, okay, we're at least we're not going in the wrong direction. But then at 9 o'clock at night, I started getting more and more pressure in my head. I couldn't hardly keep my eyes open. I was kind of weak and fatigued and wobbling back and forth. I'm like, this isn't right. Temperature was still the same. By 10:15 at night, I told my mom, I said, I'm done. I had enough. I'm going to the ER. I don't know what's wrong. I think this is getting way worse. Like the swelling, there was a lot of redness, but it didn't get any worse. It was just the same, and I felt miserable. So I told my mom, I said, do you think I could take a cold shower before I go to the ER just to see if it can help? So I said, I took a cold shower, and man, did that cold shower actually feel good. You're that boiling hot. I got my temperature down to 100. And I was very happy that at least I did something in the meantime to delay it in the event I had to wait at the ER for help or before they could get to me or something. Then at least I know I wasn't going to boil my brain out. So I was fine. I rode the whole way to the hospital like this in my seat, just moaning and groaning. And like my mom's like, how does it feel? And I'm like, it hurts. Like I had so much pressure in the back of my head and neck that I couldn't even turn it. I couldn't even open my jaw. My eyes felt like they were going to fall out. It was awful, okay? Get into the ER, whatever. Set me on the bed. Take out my vitals. Blood pressure was high. But the funny part was it didn't surprise me because I'm obviously sick. Temperature was 100. Respirations were normal. which was weird. Heart rate, still at 140 to 150. So for 12 hours straight, I had a heart rate of 140 to 150 beats a minute. I could feel my heart pounding in my entire body. I couldn't sleep at home trying to recover from this because of my heart rate. So they stick an IV in me, which is probably the picture you've seen. Took massive amounts of blood. They actually took blood from my IV. Still have my nice little marks. And they also took blood right here, which is a new spot for me, which is fine. They took blood out of here at urgent care, so I told them just to avoid that if they could. And they were very kind about it. I had really sweet nurses. So they did that. And I told them why I came here. I said because I was having a fever, nothing was getting better, the swelling wasn't going down. And mind you, I gave the doxycycline a good 4 or 5 hours before I, got checked into the ER, right? So I gave them that amount of time to get the situation figured out. Not like I just took my antibiotic at 7 o'clock at night and went into the ER at 7:30 because the antibiotic's not working. No, I understand that. Ironically enough, as we were going to the ER, like, I felt a little bit of pressure relief off my head, and I felt like my temperature was kind of cooling down a little bit. So maybe at that point, that doxycycline was kind of kicking in, but I did not like my heart pounding out of my chest. So the doctor came in, take a look, nice guy, whatever, just explained the situation, and he's like, did they tell you what this was? And I'm like, I don't really remember. And he's like, did you take any pain meds? I'm like, the nurse or the nurse practitioner never told me I could. And he was a little shocked at it. He's like, you can take Tylenol. You can take as much Tylenol as you want. You could take, he said, it's a very safe drug. I mean, you can take Tylenol when you go home or whatever. And I'm like, home, okay, whatever. So they're running the blood work. He did an exam or whatever. At this point, the monitor was taking my blood pressure, like, every 15 minutes. I had normal blood pressures after. And I'm like, that's weird to have such a normal blood pressure, but a high-ass heart rate. But if it was a low blood pressure, he said, with the high heart rate, it would be more indicative of a septic infection. So I'm sitting there, whatever, and he's like, we're going to get you some fluids, and that should calm your heart rate down. I'm like, okay. So they put me up to some saline fluids, and I gave a urine test and all those other things, and waiting for the blood work to come back in. And the nurse says, here's 2 extra strength Tylenol. I'm like, Doc wants you to take these. I'm like, okay. So I took these 2 extra strength Tylenols, and I'm getting hooked up to saline, and it felt really good. And I'm like, within like 40 minutes, the pressure in my head was just going, and I'm like, oh, this is good. This is really good. After getting a whole bag of fluid put into me, my heart rate had finally came down into the 80s. And I'm like, holy smokes. Just a little bit of saline and Tylenol is what I really needed here. But anyways, they run all the blood work, and he came back and he goes, you have really good kidney function. Everything looks healthy. You're not in DKA. He said, you do have some ketones in your urine. But I didn't get a chance to explain, like, hey, I hardly ate all day. So that's probably why. Like, only thing I had was like scrambled eggs and like 1 piece of bread. So, of course, like, my body's going to naturally burn fat, even though my blood sugars are relatively normal-ish or maybe slightly elevated. I'm going to burn ketones because I don't have carbohydrates for my body to burn. So the ketones I probably was spilling were probably not unhealthy ketones, because it said your pH of your blood looks great. All your electrolytes look really good. Everything looks fantastic. He said, the only thing I see is you have inflammatory markers. You have an infection. They tested for something called C-reactive protein, and that should be like under 1 if you're not infected. Mine was like 10 or 11, okay? My white blood cell count actually was higher than it was 12 hours previous at urgent care. It had gone up to 10 or 11,000. Everything else was completely normal. No bacteria in my urine. That was good. Like I said, kidney function was good. All that was completely normal. So other than just elevated protein and white blood cell count, I was totally fine. And I found out kind of funny, I got my first pregnancy test. I'm negative. Go figure, right? No, but I think they did that, number one, I don't know if it was a routine thing, but I never had one when I was in DKA, which was super weird. But I think they mainly did that is because tetracycline you can't take while you're pregnant. And I'm like, I don't think that's a worry for a while. So they did that. But he basically told me the ROCEPHIN they gave me was a good choice. And he said the doxycycline is also a really good choice for this infection. He goes, I don't think it's MRSA, and even the nurse practitioner at the physician's assistant at the urgent care basically told me the same thing. She said, I don't know how you would have picked up MRSA, but she goes, it's possible. So that's why she initially gave me the doxycycline, but I'm glad I went in because I didn't realize, I didn't want my heart to pound. I couldn't even sleep. Like I said, my blood pressures were fine and everything afterwards. Got my heart rate to calm down, and they put another bag on and let me run through like half of it. Actually, the first bag went in really fast, but she told me the easier your veins are to get in, the bigger your veins are, like mine are, really easy to access and get into, the faster that we can push stuff through you. So I was in the ER for like 3 hours, just sitting there, and it was actually really comfortable and everything. The bed was actually rather comfortable. Like, I'm like, I could take a nap here. But she had said, oh, okay, yeah, Doxy's, your heart rate's really gone down. It's in the 80s, bouncing from like 80 to 90. So we're just going to finish like the other half of this. And he had come in and asked me, how are you feeling? I said, oh my God, like 1,000 times better. I feel like I have the energy back. And he was very happy about that. He goes, this was an easy fix for me. And I'm like, well, I didn't really know. And he also told me this too with the cellulitis. And she didn't tell me this. He said, you go through this worst stage before you get better. He said, seeing this redness from here to here, he said that very, very consistent and normal with cellulitis. He said, it's not like, strep throat where you take the antibiotic and like 6 hours later you feel great kind of thing. He said it's massive, and it's kind of a resistant thing to fight, and you taking doxycycline, it's a big antibiotic, it's going to take its time to get in there. But he was much more on top of his game and knew what he was talking about compared to her. Not saying she's not a knowledgeable physician's assistant, because obviously she did the right thing with the antibiotic she prescribed. But I really wish she would have told me what it was so that I could tell the doctor, like, hey, like I was diagnosed with blank at urgent care and nothing seems to be getting better. Instead of having the doctor tell me, yeah, it's cellulitis. Okay. For him to tell me, like, yeah, we just needed to hydrate you more, basically, and push some Tylenol. And I'm like, well, she didn't tell me that either. And didn't tell me about, like, what to expect. She said if it doesn't get better or you have fevers, go to the ER. And I told him, I said, I feel like a dummy for not taking anything for, like, Tylenol-wise. I said, I didn't know what I could and couldn't take. And I said, I said, am I stupid for not asking? He goes, no, she's stupid for not telling you. And I'm like, okay. I know Tylenol is very safe, but I don't know. I've never been on doxycycline, so I didn't know, like, what interacts with it, what does. Doxycycline, this is what I'm taking. It's the same stuff my dog takes for Lyme disease. So my pills actually are a really pretty blue color. They're like absolutely gorgeous. Anyways, I have 16 more pills left, so I have, like I said, a week left of 14 pills. And then I just take extra strength Tylenol as needed. And he goes, you do not hesitate to take Tylenol if you have pain. It is safe for you to take to relieve the discomfort in the back of your neck, because it might be stiff for a little bit because he said you're draining all that fluid out of your infection. So he told me to do that, and he said especially keep on top of it. It's a really good fever reliever. They were able to do all that. They didn't retake my temperature before they discharged me, which I found kind of weird. Like, I came in there with 100 fever. Why didn't you take my temperature again? But anyways, they're like, yeah, looks good. I'm sending you home. Here's some information on cellulitis. And then they basically said, if you're taking the doxycycline, and like I said, the nurse practitioner didn't give me a time frame. She didn't say, like, after X days or X hours, if you get worse, go to the ER. But I'm glad I did, because like I said, my white blood cell count was elevated, and more elevated than what it was. Not to the point of needing IV antibiotics, but something wasn't right. And also, my heart rate was so rapid, I had to have multiple things pushed in my veins to get that to drop. And maybe I would have had to go anyway, because even if I took that same amount of water in a similar time frame or over the time at home, sometimes getting things pushed in your veins is that much quicker than you can ever imagine. You're getting that directly put in your bloodstream, and it's helping your body so much. And I remember, like, as it went into my body, I could just feel, like, with the Tylenol, like, the pain was going, the pressure was going, and my fatigue was going. And I'm like, okay, this is a good sign. Like, I'm feeling good. Like, I can feel like I can get up, and I was able to walk into the ER. with my mom and stuff, but it was kind of funny. She's like, giving birth is so much harder than this, and I'm like, at least you get a baby out of this. I said, all I get is a freaking headache. But it was whatever. Sometimes you just needed that extra push of fluids to get into your body. So they discharged me, and I went to bed at 3:30 in the morning. Well, I checked my temperature when I got home, and I'm like, oh, it feels so nice to have a nice normal heart rate. Thank God. And my temperature when I got home, it was back to what I normally sit at. It was like 96.9 or 97.1, and I'm like, thank God. And the nurse said, we gave you Tylenol here at like 1 o'clock in the morning, so you can obviously take some in the morning. You don't hesitate. And I've been taking it now like every 12 to 16 hours, so I'm slowly getting myself off of it. I'm not having as much stiffness or anything anymore. It was nice to be able to just, I went home and I slept sound until 7 a.m. when I had to get up and take my pill again. So then I took the pill and went back to sleep for another hour. But I finally was able to sleep knowing my heart rate was so calm and that I had an answer. And nicest ER doctor, nicest nurses ever, and I felt really well cared for. I went to the same ER where I was diagnosed with type 1 diabetes nearly 3 years ago. Obviously a different nurse and a doctor because this was on the graveyard shift, but they were really awesome, and I couldn't be more thankful that I went because, like I said, sometimes you just need that extra push with something in your veins versus something taking whatever. And then by the next day, let me tell you, this thing looked amazing. Like, after getting the doxycycline in again, I have to take it for 10 days, but it looks really good now, you guys. Look how awesome. It's not even red anymore. This thing was red from here to here. The only thing now, if you see it's shiny, it's because I put antibiotic salve on it. I do it because they tell me for the infection, but I find it more helpful than the infection control of it, that to take this. It takes away the itch, because right now I have this, it's itchy. Occasionally I'll get a little burning sensation as things are healing, but it's not like it was where it was like, oh my God, I felt like somebody set my neck on fire kind of thing. But it's feeling so much better. I feel so much better. I remember going through this. I want to talk a little bit about like my thought process. Like, I was so angry to have this because I'm like, what in the hell did I do wrong to like get cellulitis of all things? But it can happen to anybody, and I encourage you to go in and get something like this looked at if you have something that's just massively getting worse and worse. You don't have to be diabetic. You don't have to have any problems. You can just have a tiniest little microscopic abrasion in your skin that you can't even see, and you can get cellulitis, okay? Like I said, my thought process, I was very negative. I was very angry. I was very, like, losing my wit's end. Like, I kept telling my mom how sorry I was, and crying, yelling, it hurts, screaming, like, in my own, like, little world. Like, I was miserable. I kept, like, saying things over and over again. So negative thoughts. But I really honestly think some of the negative thoughts, I think the pressure in my head was so intense that, like, and the back of my neck was so intense that all I could, like, it was like the physical pain was messing with my mental thoughts, okay? Like, it was just, like, not healthy. And I, like, when I got to the ER and, like, before they even, like, fixed my problem, like, I felt like, I felt a lot better that I went knowing that they're gonna freaking fix me, you know, or do something about this, or at the very worst, I'm starting to go septic, and they can at least push IV antibiotics, and I got here in time enough before it could do anything. But this was caught very much in time. If you don't, like I said, it can go septic, and why would you want to suffer with that? Like, suffering with a local acute cellulitis is bad enough. I don't think you want to suffer with any more. But it was really hard for me to stay positive, and I'll admit to you that. I'm a very positive person. I'm a tough bird. I can handle I can take needles, I can take pain, I can take this and that. But this was awful. This is like, I don't wish this on anybody. Sometimes I think about, like, people who take their health for granted. Like, sometimes you wonder, like, if they would have something like this, how they would handle it. Or if you think maybe that would not have them take their health for granted. I'm like, geez, another medical problem I got to worry about. That's, like, the kind of attitude I was having. But maybe I have this because I had it because I'm here to share this experience with people, and to share it to people. Like, if you catch this early enough, it's a fairly relatively easy fix. Not saying it's going to be smooth sailing, peachy keen roses the whole way through, but get the right antibiotics and you're taking them as prescribed and you're doing everything that your doctors tell you, it's going to be awesome, right? Like, you're going to get this thing healed. This will occasionally turn a little red if it gets hit by warm water. Sometimes I'll accidentally bump my skin here and I'll just get a little red flare up, but I don't physically touch the scab. The scab is kind of shrinking and going down, and that kind of thing. So the antibiotics I'm taking are a little insulin resistant on me, but not too terribly bad. I'm not messing with any of my basaloids. They seem to be pretty good. I'm just be more cautious about like injecting quite a bit of insulin for food. And with the doxycycline, it does not bother my stomach. I can take it on an empty stomach, or I can take it with food. You have an option with it. Just so you know that if you end up taking it. If you do think you'll get nauseous, just make sure you take it with food. You got to stay out of direct sunlight for a while with it. I can go, obviously a little sunlight isn't going to kill me, or this like light isn't going to kill me, this ring light, but they don't want you being exposed to direct like blazing hot sun, like sitting out gardening all day. And then same with these pills. You can't keep these pills. It's in a darkish bottle, as you can tell, and it's completely wrapped up with the label, but you don't want these pills, you don't want to throw these pills in the middle of the sun either, because it will just break them down. And I take the pills twice a day. It's a 12-hour thing for 10 days straight. So that just tells you when you have to take antibiotics like twice a day, they're 100 milligrams a piece, and you have to take them for 10 days straight, and it's a big old antibiotic that you know that they give dogs for Lyme's disease, and that they use to treat MRSA. Like, you know that this is kind of a serious thing. This is kind of a resistant infection. Like, cellulitis is kind of a itch with a bee to treat if you don't keep up on it, but I'm keeping up on the antibiotics, doing as they say here. And it gets even worse if it goes septic. But anyways, so far my antibiotic experience is not bad with diabetes. I know some people really complain about like how bad their blood sugars get with antibiotics, but so far it's just a little bit of resistance, if not really. I think it's more hormonal for me, because I'm like ovulating right now, and it could be a combination of both, but my blood sugars haven't been ultra terrible. So anyways, that's my experience with antibiotics and cellulitis and X, Y, and Z. I'm healing, I'm well, I'm alive. I hope this explains the situation, and this video is now 40 minutes long, so I apologize again. I go on a rant and rave, I guess, again, but I think this video was pretty informative, and I stayed pretty close to what this whole story was, and I want to make sure I include all the details, because this can happen to anybody. And if you have anything like this, please, please, please go see a physician and get it taken care of. So anyways, I hope you guys enjoyed this video. If you did, give it a big thumbs up. Feel free to hit that subscribe button. I post as often as I can about diabetes plus more. Stay tuned for more videos coming from me. And I hope the cellulitis survival experience helps you all out. And I hope you never ever have to deal with it. Just keep your wounds clean. And I'm like ultra conscious about like keeping everything clean. Not saying I never did before. But if you have something like this and maybe had a little microscopic that you couldn't see and it got infected, boom, go to the doctor. Get it taken care of right away before it turns septic. So anyways, until next time for another video, take care, God bless, be kind, spread positivity, and be thankful. I love you all from the bottom of my heart. Bye.